Dr. Rachel Coleman is an assistant professor of neurology at the Icahn School of Medicine at Mount Sinai. She received her medical degree from Ben Gurion University. Dr. Coleman, thank you for joining us today.
Thank you so much for having me. I want to thank the National Headache Foundation for inviting me to speak, and thank you all for taking time out of your evening to listen to me. I really appreciate it. Today we're going to talk about caffeine and headaches, and it's a very interesting topic. There's a lot of misinformation out there. There's a lot of confusion. It has great benefits and it has great challenges. So hopefully today we can go through some of the benefits and the challenges, and we can all learn something together. So caffeine, if you're going to look at its chemical name, it's 1,3,7-trimethylxanthine. It's naturally occurring. It's a stimulant. It's found in food and beverages. We know it most found in coffee, in cola, in tea, and in chocolate, and the common coffee beans that everyone's familiar with. About, if you look worldwide, 90% of people in the world use caffeine in some form or another. In the U.S., about 80% of adults consume caffeine every day. If you go into a coffee shop, you will see that many teens are using caffeine as well very regularly. The average adult uses about 200 milligrams of caffeine per day, and I think it's important to understand what 200 milligrams of caffeine is. So a brewed cup of coffee contains about 60 to 100 milligrams of caffeine in a 6-ounce cup. And the reason for the variance is that people brew their coffee differently. A stronger drip, you'd end up with a larger amount of caffeine. Just to understand, a decaf cup of coffee, the same 6 ounces will give you 2 to 5 milligrams, so a very small amount of caffeine in decaf. So just for everyone's understanding of what a 6-ounce cup is, you know, in the days where we all go to coffee shops, not going to name them, we have larger and larger cups of coffee. The center there is the 6 ounce. It's the smallest cup. It's a true cup. All the other cups are much more. So we're going to get the largest size at any of the major brands of coffee stores. You might end up having your full daily dose or even more than your daily recommended dose of caffeine in one cup. When looking at other sources of caffeine, soft drinks contain about 30 to 60 milligrams depending on the soft drinks. And these are soft drinks, of course, that are caffeinated. The various colas, even Mountain Dew is caffeinated, and it's important to recognize that as well. Tea, depending on how long you brew it and what variety of tea it is about 40 to 80 milligrams. So it's surprising that tea can actually contain quite a lot of caffeine. Common headache medications, so medications that are sold over the counter that contain either Tylenol or ibuprofen and caffeine, can contain anywhere between about 16 to about 65 milligrams of caffeine. And again, you need to recognize that if you're using those medications, you can quickly, if using a few per day, go over your daily recommended dose. Caffeine pills, prescribed or over-the-counter, often contain the full 200 milligrams of caffeine that would be the limit of a recommended daily dose. So caffeine is lipid-soluble, and lipid is a fat-soluble molecule, and what we understand in fat-soluble molecules is that they're able to get through the blood-brain barrier. The brain is very treated very smart, and it limits certain molecules from getting in. Caffeine, because it's soluble in fat, can get in. It becomes active in your body about 6 to 8 minutes after ingestion. So after you drink your cup of coffee, you should start to notice effects in a little less than 10 minutes. It's fully active. It's reached its peak effect somewhere around 30 minutes when you really start to feel awake and alert. The half-life of caffeine, the amount of time that it's really active in your body, is between 3 to 5 hours. So you'll still feel that caffeine effect up to 5 hours after you had your first cup. It's eliminated by the kidneys. The kidneys clear it for us. So what effects does caffeine have on the body? Most of us, if we've had some sort of caffeine, know some of them, but it's important to review. Caffeine is a stimulant. And how does it work as a stimulant? It's a very interesting mechanism. Adenosine is created in the brain, and it binds in the brain to adenosine receptors. This binding causes drowsiness. It slows down nerve cell activity. In the brain, when adenosine binds to the adenosine receptors, blood vessels will also dilate as a byproduct of this binding. Caffeine looks very similar to the brain, to adenosine. It's able to bind to the adenosine receptor, but without causing these secondary effects. So the cell no longer can identify adenosine because the caffeine is taking up all the receptors that adenosine would normally bind to. So instead of slowing down as a side effect of adenosine, the nerves speed up. Caffeine also then will cause the brain's blood vessels to constrict because the adenosine that would have, it blocks the adenosine's ability to open them up. So caffeine's basic effect on the brain is increased neuron firing. What happens then is the pituitary gland senses this activity and thinks there's some sort of emergency going on because of this increased firing, releases the hormone that tells the adrenal glands to produce adrenaline, otherwise known as epinephrine. So adrenaline is the hormone in the brain that is our fight or flight hormone and has a number of effects on your body. Your pupils dilate, your airways open up, your heart beats faster, blood vessels on the surface constrict, blood flow away from possible cuts and bruises and into the muscles, blood pressure rises, blood flow to the stomach slows because you don't need, in an emergency scenario, to digest your food. You need to run. The liver releases sugar into the bloodstream for extra energy, and your muscles tighten up and are ready for action. So the secondary effect of caffeine is release of adrenaline, and you are geared up and ready to go. It's all wonderful and excellent, and we all enjoy the side effects of caffeine very much. Unfortunately, it has some untoward side effects. We prefer if it didn't happen. It can actually relax the lower esophageal sphincter and predispose you to GERD, or gastroesophageal reflux disease, where the acid in your stomach rises up and causes quite a lot of upset and pain. It will also cause gastric hypersecretion of acid, which leads you to be more susceptible to ulceration. So not only do you have reflux, you can also have an ulcer in your stomach. Caffeine is a diuretic. It can increase your urination, and in high doses, it really predisposes people to dehydration because of the diuretic effect. So that's some of the good things, some of the not so good things, and then some of the effects when we stop using caffeine. So caffeine is really different than cocaine or opioids. It's not addiction in the same way. It doesn't go to the same reward and addiction centers in your brain. However, many people do experience withdrawal symptoms from stopping use. These are not severe, these are not dangerous, but they can be incredibly uncomfortable. Some of the withdrawal symptoms people will notice are headache, irritability, sleeplessness, confusion, palpitations, nausea, anxiety, a sense of restlessness, even tremor or raised blood pressure. So what are caffeine withdrawal headaches? This is something that people who frequently use caffeine and then stop will have experienced. Its diagnostic criteria based on the International Headache Society's guidelines is a bilateral pulsating headache. The guidelines say that you have to have consumed at least more than 200 milligrams per day for 2 weeks. That is then interrupted or delayed. For some people, even lower doses of regular use with stopping or delaying caffeine will trigger this headache. The headache develops usually within 24 hours of your last caffeine intake and is relieved within 1 hour by 100 milligrams of caffeine. The headache should resolve within 7 days after total caffeine withdrawal. Toxicity and overdose. Really high doses, 250 to 500 milligrams, so just a little bit more than the recommended daily use, can result in your restlessness, nervousness, difficulty sleeping, and tremors. If someone were to ingest more than 10 grams, that could be fatal in an adult. Overdoses can cause a hyperadrenergic syndrome, which is basically too much adrenaline. Too much of a good thing is never good, and it can lead to seizures and cardiac instability. So I really recommend that people exercise really great caution with energy drinks that contain a lot of caffeine, especially when mixed with alcohol, and people are really not recognizing the extent of caffeine that they're using. So that's all about caffeine. And now, how does caffeine work to help pain? So typically, caffeine is used as an adjuvant, meaning it's not directly acting on pain receptors, but it's helpful to other pain medications and can enhance anti-pain properties. So when you add caffeine to pain medications, and the typical ones that's been added to are acetaminophen, aspirin, indomethacin, and prochlorperazine, they enhance both the absorption of these medications by increasing the acidity in the stomach and their ability to then relieve headache. Studies have shown really good benefit for adding caffeine to a pain medication such as Tylenol for an episodic tension type, as well as even episodic migraine headache condition. Some studies even showed that when you added a caffeine to these medications, you needed less of the drug. So the same effect you would get from less of the analgesic drug. How do we think this works? Caffeine constricts blood vessels in and around the brain, which is thought to be helpful in headache, since the current data, which always is changing, suggests that blood vessels tend to enlarge before the beginning of some headache pain. This is all well and good, and we wouldn't be having the discussion if caffeine was all good for headache. Unfortunately, a common and frequent headache disorder that I see in my practice is medication overuse headache. So while medication overuse headache could have a long discussion in and of itself, I want to briefly talk about it here because of the dangers of caffeine overuse. The International Headache Society talks about medication overuse headache as an interaction between a therapeutic agent that's used excessively and a susceptible patient, meaning if you take too much acute medication to stop a headache and a patient that is headache prone. To make a diagnosis of medication overuse headache, the patient must have a headache that occurs on 15 days per month, at least, in a patient that has a pre-existing headache disorder, and they regularly overuse for more than 3 months one or more drugs that can be taken acutely or symptomatic treatment of headache. It usually, but not always, resolves after the overuse stops. We have new headache guidelines that come out every few years. The old guidelines suggested that in order to make the diagnosis, the headache has to go away. New data suggests that with regular use of these agents for more than 3 months in a row, even after you stop the offending agent, sometimes the headache cycle continues in and of itself, even without the agent. However, with stopping the agent of overuse, your headaches have a much greater chance of getting better with prevention. So in some cases, the problem begins when the patient starts taking an immediate release medication or medications at the slightest hint of an attack. This approach, it can really evolve into a habit of treating in anticipation of a headache when no pain exists. And then those people often get into a headache medication cycle that's self-sustaining. The head pain ends up being chronic. The treatment with immediate relief just continues and becomes more frequent and becomes the cause of the head pain. And we're not entirely sure how that happens with each agent of overuse. So some people overuse caffeine-containing pills. Some people overuse just plain Tylenol. Some people overuse Advil. Some people overuse medications like Fioricet. Some people overuse triptans. Any of these agents, when overused, when used on average more than 10 days a month for most of these meds, can cause this medication overuse phenomenon. Each of these agents have their own kind of way of doing it. But we think the general rule is frequent use of these drugs changes the way your body responds to pain. And there's a reversible metabolic change in your brain's pain processing centers that makes them hypersensitive to pain and continues the pain process. So how do you get out of medication overuse? You withdraw the offending agent as soon as the problem is detected. So you stop the drug. You provide supportive measures. Sometimes it's fluids, IV, pain medications, treatment of withdrawal symptoms during the period of increased headache intensity and frequency. Sometimes we even admit patients to hospital. Now, it's pretty rare that I admit a patient to hospital for a caffeine overuse headache because there isn't any danger involved in the behavior. Most people are able to wean the caffeine off on their own. But some other agents, we often need to admit patients to hospital. Once the cycle of medication overuse has been broken, patients tend to return to their pre-medication overuse headache condition, which is usually an episodic headache disorder. So when do I use caffeine to treat headaches? I use it in rare or episodic migraine or tension type headache when there really isn't any risk of overuse. And I use it in two specific types of headaches called hypnic headache and low pressure headache. So hypnic headache is a very interesting and very rare headache disorder. It's often called the alarm clock headache because it's episodes of dull head pain that develop only during sleep and awaken the sufferer from sleep. It's almost exclusively after the age of 50. There are rare cases of younger people. It's pretty frequent, often 15 days or more per month, often many, many days in a row. And it usually persists for at least 15 minutes after awakening and lasts no longer than 3 hours. This isn't a long-lived headache disorder. but on occasion there are people that have longer durations. 2/3 of people with hypnic headaches have the headache occur bilaterally on both sides of their head. It's usually a pretty mild to moderate dull intensity, but some patients do have severe pain. Throbbing or migraine features of nausea, light, or sound sensitivity are pretty uncommon with hypnic headache. You need to exclude other mimics, other things that look like hypnic headache. Certain tumors can wake people up at night, or even nocturnal hypertension, people who have really high blood pressure that occurs overnight. So caffeine is really the first-line therapy. This is one of the most interesting therapies. People are quite surprised by this. I tell the patient to take a strong cup of coffee, about 6 ounces, sometimes a little more, when they awaken with a headache, or they can pre-treat with a strong cup of coffee before going to bed. You would think if people drank a cup of coffee before sleeping, they would never be able to fall asleep. However, sleep problems related to caffeine use rarely occur. There's some disorder with their sleep-wake cycles that the caffeine seems to fix. Analgesics containing caffeine are also effective. You can use them acutely. However, they carry the risk of medication overuse headache when used too frequently. So just sticking to one agent and not using any analgesics is often the best thing. So sticking to just caffeine is what I generally recommend. Non-steroidal anti-inflammatory medications, ibuprofen and the like, opioids, oxygen, Tylenol are not effective for this disorder. For some people, triptans, which are a mainstay in migraine, can be effective. When caffeine doesn't work, I go to lithium. It's a second-line treatment. It's been effective in many patients. It's often discontinued due to side effects. It has a number of side effects that some people don't want to have to prevent this headache disorder. Occasionally, we can use indomethacin, which is another non-steroidal anti-inflammatory that has been helpful in some people. The other kind of headache that is treated with caffeine is a low-pressure headache. So low-pressure headache is due to loss of cerebral spinal fluid. That's the fluid which flows around and cushions the brain. And the loss of fluid reduces the pressure around the brain. The brain then sags downward, stretching the surrounding tissue and nerves. The stretching of this tissue and nerves is what causes the headache. It's often due to a spinal tap, a lumbar puncture, the removal of fluid, or then the subsequent leakage due to the hole that is not closed up. Occasionally, it can be due to spontaneous leakage. There was no procedure. It's often due to a cyst or a tear in the lining of the brain called meninges. The pain is generally not present on waking. When you lie down, you feel very well. It worsens during the day and is relieved by lying down, usually within minutes. It takes only minutes, even up to an hour, for the pain to return when the patient is again upright. People can have a number of associated symptoms with this headache, not just headache, but decreased appetite, nausea, vomiting, vertigo, ringing in your ears, which is called tinnitus, and double vision. And these have to do with the sagging features that we spoke of before. If the headache occurs after LP or lumbar puncture, there's really no further workup needed. If it happens on its own and it sounds very much like a low-pressure headache and there was no procedure, we'll often do further testing, including an MRI with gadolinium, and that's contrast. And we usually find a finding called papillomeningeal enhancement, which means that the meninges kind of look thick, and that's because of the sagging nature and the pulling. And here's a picture of what that would look like on MRI. And this is an MRI of the brain of a patient that had a low-pressure headache after a lumbar puncture. And so you see the arrows are pointing to the meninges, and those are bright, and those are surrounding the brain, and those are thicker than they usually would have been. So treatment for low-pressure headache includes bed rest, because when you lie flat, you feel well. Fluids to increase the pressure and stop the pulling, as well as drinking caffeinated beverages or even IV caffeine. Why is that? Why does it work? Why does caffeine work here? So it's an interesting mechanism. It's thought that cerebral arterial vasoconstriction by caffeine, so the arteries that constrict themselves due to the caffeine side effect, will result in less blood flow to the brain. And then the blood volume in the brain is then able to expand and leading to more space in the brain. If there's less blood in the brain can kind of swell up a bit and has more space to stretch. It is not pulled downward as much. We also think that the caffeine may increase the production of cerebrospinal fluid to cushion the brain further and stop the painful sagging. If all of this is an effective lying flat, loss of fluids, caffeine, we can do an epidural blood patch, which is a very interesting procedure. Well, we take some blood from the patient and we patch up the area where the lumbar puncture was done, creating kind of a seal to prevent more fluid from flowing out. So that's all that I have to discuss with you today from a formal presentation standpoint, and I thank you all very much for listening, and I'm excited to hear anyone's questions or comments.
Okay, thank you, Dr. Coleman. It looks like our first question comes from John, and he would like to know, will caffeine speed up the triptan medication pain relief?
Oh, I'm so sorry, but I didn't hear you.
Okay, our first question is from John. Will caffeine speed up triptan medication pain relief?
It can. It definitely can. Some people will notice that if they have a cup of cola or coffee with their triptan, they will have a faster relief. The only caveat is that if you're already having 200 milligrams of caffeine a day, frequent use can trigger more headaches in the long run, so you have to be cautious and careful.
Okay, let's see. Our next question here is from Carolyn. Why does caffeine sometimes give me a headache and other times it relieves my headache? I have migraine.
Yeah, that's a really good question. So caffeine is a migraine trigger for many people. So in the right circumstance for you in particular and for many people, caffeine may be a trigger for your migraine. However, in the right circumstance, the caffeine will act as an adjuvant, increase the acid in your stomach, help you feel a bit better. So you're in a catch-22 scenario that many people find themselves in. I recommend to people that are sensitive to caffeine that triggers their headache to cut down their daily use of caffeine further than 200 milligrams, maybe cut it down to 100 milligrams so that they're they're able to use caffeine on occasion when they get a headache to see if it helps them. However, some people, it's really hard to predict, and they should just stay away from caffeine as it's a known trigger. Chocolate is also a trigger for migraine for many people. It may be the caffeine in chocolate, and it may be just the chocolate itself.
Thank you. Our next question is from Joanne. Can decaffeinated coffee or tea cause migraine? I was told that the process of decaffeination itself can cause headaches. Is this true?
So if I understand you correctly, you want to know if decaffeinated coffee can cause migraine? You know, I am not aware that the decaffeination process causes headaches, but there are people who are very sensitive to different kinds of foods and drugs, and so there may be someone who the decaffeination process can lead to headaches, but it's not true for everyone. So what I would do for you is do a trial and error, and decaffeinated coffee or naturally decaffeinated tea doesn't, or even decaffeinated tea does not cause you any trouble. I wouldn't worry. There are so many things out there that can trigger migraine or trigger headaches in different people, and it's really hard to figure out what each person should be doing. And the best thing to do is do a really good headache diary for yourself. Really try and look at what your activities are, what your food intake is, your exercise and your sleep, your hormonal pattern, and see if you can figure out a trigger. If every time you have MSG-related products you get a headache, or if 2/3 of the time that's a trigger for you. If you get a headache once after eating kiwis and never again, probably kiwis isn't your trigger, but I do have a patient that kiwis is a very clear trigger for her. So it's really a personalized choice and not something that you should worry about unless it's causing you trouble.
Our next question, how do you stop caffeine use, including pills? I know it's in drinks, pills, and chocolate, but I'm most concerned with the pills. How do you know with prescription medication?
Okay, so I'm going to answer your last question first. So prescription medication that contains caffeine will be labeled on the bottle. In order to contain caffeine, it has to be labeled. So common I hope it's okay to name brand names, but Fioricet, Fiorinol both contain caffeine. Excedrin, which is over the counter, contains caffeine. Most of the headache medications that's over the counter that's marketed as migraine or tension type headache contain caffeine. So a cautious and careful consumer needs to look at the labels and really read and really ask questions of their doctors and providers what they're providing to them. The drinks, the pills, and chocolate, most people know about. And how you stop use is a good question. So stopping use of caffeine cold turkey is not recommended because you'll end up with caffeine withdrawal headaches and you'll be miserable for a couple of days, which isn't pleasant. So I always recommend to my patients if they're overusing caffeine or they want to be careful to cut down their caffeine to do it slowly. So look at your day, do a diary for a couple of days and evaluate your intake, figure out how much you're using, and then make a plan for yourself to wean yourself off over about a week or so. Some people, they can do it shorter. Some people, they do it longer. If you're using caffeine in soda or in coffee or in tea, I recommend to either make your cup smaller or mix with half decaf coffee. Most people really, really enjoy the experience of caffeine. It's really pleasant to wake up in the morning with a big mug of coffee or a lovely cup of brewed tea. So I don't want to ruin that experience. That's very pleasurable. But switching out half decaf or a quarter decaf each, couple of days till you slowly wean yourself off the caffeine or make yourself use a slightly less amount to put yourself in a safe avenue is how I recommend you do things. There is nothing dangerous about stopping caffeine cold turkey. So if you're just, want to do that, it's unpleasant but not dangerous. Other medications that you may or may not be overusing may be dangerous to stop cold turkey. So definitely discuss with your physician before stopping any medications that you've been using.
Thank you. Our next question, how is hypnic headache diagnosed?
So hypnic headaches are diagnosed by listening to the story and teasing out that it sounds pretty different than migraine. Migraine can wake people up at night, but just the frequent nature of the same time frame and the story. And then really, if I'm curious if it's hypnic headache or not, I tend to give my patients caffeine and see how they do. And most times they'll send me a message saying, that was amazing. My headache is gone. I have people that have had hypnic headaches for years that just thought this was them. A careful neurological exam to rule out any other issues, getting them evaluated by their primary care doctor to make sure this is not hypertension, making sure there's no further studies that need to be done, and then it's trial and error. You try the caffeine and see if it works.
Our next question here, are there any widespread but not well-known hidden caffeine sources in foods and drinks that you usually warn your caffeine-sensitive migraine patients about?
No, I don't really. There's not any common. The hidden one is Mountain Dew that people don't know because it's yellow or orange or color that is caffeinated. That's something that I warn people about. Some people aren't aware of how much caffeine is in chocolate. But short of that, most caffeinated beverages are labeled as caffeinated beverages. Energy drinks, be very, very careful and read them carefully to see how much caffeine they contain to, make sure what you're doing. But those are the things I usually warn people about.
Thank you. Our next question, would caffeine help stop a migraine triggered by a low pressure weather change?
So that is a good question, and it's very personally dependent. So low pressure weather changes is a really common migraine trigger. Most people have it. If you live in the New York area, which I do, it's been a really rough number of days with pressure changes and headache. Caffeine is not in and of itself usually good enough to stop most people's migraines. It's an adjuvant. It's used together with other agents, and it can be helpful. So I advise patients, again, to exercise caution. If caffeine helps you and your headaches are infrequent, then it's an absolutely safe thing to use. If your headaches are frequent, you have to be careful and go to your doctor to get a better management plan. The nice thing about caffeine is that it generally, as long as you're not overusing it, doesn't hurt. So it definitely is worth a try.
Our next question, are you aware of any artificial sweeteners that have been shown to cause migraine?
So in some people, artificial sweeteners are a trigger for migraine, but not in everyone. So it's important to do a good diary and see what's going on with you and your headache triggers. Sweeteners are not the cause of migraines, but they can be a trigger, and each and every person is different with their own set of triggers. And so it's hard to make hard and fast rules. I tend to give my patients lists of common triggers and then have them try and identify on their own patterns to recognize.
Lately, I've been using melatonin before sleep and then have been able to sleep well. And I believe she's saying she drinks small bottles of Coke occasionally during the day, and she feels better the next day. Are the two safe to take together at night?
So this is kind of a complicated question. She has wake-up headaches. She thinks they're migraines, and it's too late to stop them. Hard to tell the difference and know when to take migraine medicine, which is hard with wake-up headaches. She's been drinking some Coke at night in hot weather to see if that was caffeine withdrawal causing AM headaches. Maybe 2 bottles of Coke, the small bottles, and felt better the next day. And then she was also using melatonin before sleep and was sleeping well. And she wants to know, are the 2 caffeine at night and melatonin together safe? And then there were some problems with other medications in the past, and the sleep cycle was very off. So this is a multi-pronged question, and we'll try and help is tease out the issue of wake-up headaches. So there's a number of headaches that can wake you up, and they're not all hypnic. So wake-up headaches, migraines often wake people up, in the middle of the night with the migraine, as well as hypnic headache. If you have a migraine disorder and your headaches when you wake up are migrainous, it's likely migraine. Now, the difficulty of migraine when they wake you up is that often you're right in the middle of the headache attack. And with migraine, the earlier you treat, the better. Now, I don't recommend anyone taking, before they go to bed, caffeine to kind of prevent caffeine withdrawal headache. Because as soon as you start using more caffeine at any time, you're going to end up with your body needing more and more and more and more caffeine and end up with medication overuse headache in the long run. So if you're having what you think are caffeine withdrawal headaches and you're having them frequently, the sign is it's time for you to start to reduce your caffeine intake. And that is the smartest way to get rid of these headaches. Might not be the fastest way, but it's the one that's going to help you most in the long run. If you're having really frequent wake-up headaches, often you can see your doctor about options in terms of medications to treat these headaches in terms of prevention. Because when headaches are too frequent, prevention is really key. There are many different medications that we can use for wake-up headaches. There are some injectable medications that we can use, some fast-absorbing medications that can be used. Often I recommend people having their medications by their bedside to combat the difficulties associated with this. I hope that was helpful. So I think that was our last question, and I want to thank everyone here for listening, and I hope you found this helpful. And I understand this is going to be up on the website to refer back to should you need any more information. And the National Headache Foundation website has tons more information regarding these topics for you. So I hope everyone enjoyed, and thank you very much.
Thank you, Dr. Coleman, for joining us, and everyone, please head over to headaches.org to see our upcoming webinars throughout the month of June, which is Migraine and Headache Awareness Month, and have a great evening.